What do ancient Greece and 21st century healthcare policy have in common? It turns out quite a bit. And to illustrate this, we're going to take a short journey to the intersection of healthcare policy, philosophy, history, and of course today, creativity. We must find a sustainable solution to healthcare. To succeed in this endeavor, we're going to need to engage millions of people in this process. We're going to need to harness the timeless yet underutilized wisdom of Hippocrates, the father of medicine. And we'll need to boldly compete with the wildly successful marketing around the world of unhealthy behavior. We are creators. It's time for a bit of creativity. We need to market healthy behavior. But before we go there, we need to define the problem that is begging for a creative solution. We're in a bad place. Individuals, business, government are all struggling under the weight of what we call a healthcare system. Individuals here in the United States oftentimes face bankruptcy because of their healthcare bills. Their healthcare premiums are oftentimes larger than their home mortgages. Businesses, handicapped by this healthcare system and the cost of our healthcare system, can't compete in a global marketplace. And yes, local, state, and federal governments are having a difficult time trying to balance other elements of what they need to pay for. Things like infrastructure, education, and maybe advancements in technology. And it's not just us. Other countries with other healthcare systems, some of which you might find more appealing than ours, they still struggle with sustainability. But let's look at the United States. $3.5 trillion. That's a lot of zeros. $3.5 trillion spent this last year in healthcare in the United States. By 2027, that's expected to be $5.9 trillion. It's almost 20% of our economy. Half of that is paid for privately, half of it by the American taxpayer. What's the value you're getting for every dollar spent, whether that's private or whether that's a public dollar? Let's evaluate that value. If you look at the 35 countries, most economically developed countries on the planet, we rank 29 out of 35 on infant mortality. We rank 26th in life expectancy. $3.5 trillion spent per year, and we rank 26th on life expectancy? Why? How did we get to that spot? Well, it turns out in America, we've invested all our time and energy on sick care rather than health care. We wait for disease to happen, to occur, the chronic disease that develops, and then we take action. We're paying a heavy price for that wait before assessing the true origins of the problem. So how do we go from sick care to health care? Well, it turns out we have an opportunity. 40% of the cost drivers are behavioral. So that leads for an opportunity. But we've dug ourselves a pretty deep hole. It turns out among that upper echelon, the economically developed countries of the world, we rank first in chronic disease. It's our modern day plague. Centuries ago, infectious disease would come along, and in days and weeks and months would kill off millions of people and cause illness. Now we deal with chronic disease. It takes years and decades to develop, slowly but surely. So how do we go? Where do we bridge that gap? We are outpacing other countries on developing chronic disease, but not focusing on healthcare. So we need to make a fundamental shift from sick care to healthcare. We can't build our way out of this mess. More hospitals, more ERs, more clinics, and medications that cost $500, $1,000 a month to treat chronic disease that we could have prevented. That doesn't sound like a plan. We need to shift sick care to health care. So the foundation of that is prevention. Prevention, and maybe addressing those chronic diseases before they occur. Again, maybe sometimes it's the road you're on and not the car you're driving that's the problem. The road we're on, there's a whole lot of chronic disease occurring in our society. So 2 components to great prevention that have to be understood. First one, social determinants of health. Second, commercial determinants of health. Let's first look at the social determinants of health. That's the food you eat, the availability of food. It's the house you live in, maybe the availability of a home. It's your education, the environment. And it turns out where you live. In fact, zip code is one of the best predictors of your health here in the United States. Where you live wraps up with the social determinants of health. And those countries that are outranking us on some of those measures, all sorts of those measures looked at, they're spending a higher proportion on the social determinants of health than we are, and they're getting better value out of their health care. Second one, commercial determinants of health. That's the money spent marketing unhealthy behavior. Commercial determinants of health. Let's take some data from the Centers for Disease Control, the CDC. $2 billion every year in the United States spent marketing alcohol. What do you get for that? These are in billions now. $250 billion per year spent taking care of alcohol-related disease per year. How about obesity? $11 billion spent each year marketing food and beverage. It's estimated about 80% of that is spent marketing food and beverage that isn't so great for us. Advertising works. The United States per capita consumption of sugar is greater than anywhere else on the planet. And now we have an obesity rate that's just approaching 40%. What's the annual cost of obesity in the United States? Chronic disease related to obesity? $190 billion. How about tobacco? $9.5 billion spent every year marketing tobacco. That'll buy you $170 billion of expenses on chronic disease-related tobacco. And now we have companies marketing nicotine to the youngest generation. Vaping is becoming an epidemic. And some of those folks will end up using tobacco products. Opioid epidemic. We know the pharmaceutical companies are spending billions of dollars every year marketing their products. And for a while, they were heavily marketing their opioid medications. We spend $78 billion and growing, $78 billion per year on the opioid epidemic. This is not sustainable. This is important. We could design the best healthcare system this planet has ever seen. And under the weight of that level of chronic disease, we don't have a chance. So here's where the intersection is between healthcare policy, history, and philosophy. Hippocrates, the father of medicine, 2,500 years ago. He lived about 90 years of age. That's pretty good for ancient times. And you should know, healthcare costs during those times was also an issue. But if you look at the teachings of Hippocrates, his writings, you saw how he believed in the importance of the balance between what you eat and the exercise you get. he also spoke about the responsibility of the individual and those surrounding him. Let's look at a couple of quotes from Hippocrates. Let food be thy medicine, and medicine be thy food. Let food be thy medicine, and medicine be thy food. 2,500 years have passed, and as a physician, I still can't write a better prescription than that. Another quote. There are in fact two things, science and opinion. The former begets knowledge, the latter ignorance. If we're going to fix this, we're going to have to rely on facts and science and some of the data from the CDC. We're going to have to maybe push away some of the opinion and politics that are keeping us from our destination. As time went by and Hippocrates and the folks following Hippocrates followed him, they understood the degree of importance that Hippocrates was placing on responsibility. And a quote now from a book on Hippocrates by Jacques Joanna is very important to where we're headed. And I quote, "The patient is therefore conceived as having duties as well. Just as a physician is subject to a certain code of behaviors, so a standard of conduct applies to the patient and the people surrounding him." The patient and the people surrounding him, society. All right, so now we have some important ingredients. We've got our problem, we've got social determinants of health, commercial determinants of health, and we need to throw in some responsibility from the patient and from society. Sounds like we have the makings of something big. Sounds like we maybe have something that can lead to a solution. Some medicine. In this case, we're not going to take that medicine with a spoonful of sugar. It needs to be creative. Of course, it needs to be creative. It needs to be innovative. But I think one of the most important elements of addressing a big problem and getting to where you need to go is it has to disrupt the current system. All right? It has to change. If you look at a business or maybe an individual or a country or a society that really took on a big problem, can that be done without disrupting what they're doing? No, it can't. So we need to get past the willing. We have to get to the do. So what's the plan? Okay. Well, as I said, we want to market healthy behavior. Set that in place. We're going to start with the youngest individuals over 18 to 25. All right? And then we have to be able to say, where's the incentive for those folks to live a healthy life? And so you start looking at the individual market, buying insurance, but you also have to look at the Medicaid population because that's a growing segment of the population that we need to activate and engage. On the private insurance side, we're going to look for a discount, a voluntary discount to sign up. Think about your auto insurance policy. Safer driver you are, you get a good discount. Why is it we don't do that in healthcare? Safer liver? Discount. So it makes intuitive sense, but let's carry that through. Again, voluntary, sign up. You're not going to use tobacco. You're going to keep your weight in a reasonable range. You'll write down, I will not have a claim related to alcohol. I'll get my preventative medicine done. I'll get my immunizations. And from a social determinant standpoint, I won't have a felony. I won't be convicted of domestic violence. Won't have a DUI. And you get yourself a great discount. We're going to try to get some actuaries to score those. But the discount on those plans should be heavy and big. We should be able to pass that on to the consumer. Now, on the other side of the equation, Medicaid. How do you incentivize folks that don't have a premium? It can be done. So on the Medicaid side, absolutely have people voluntarily sign up, and they can be afforded a financial incentive to do that. Now you're saying, a financial incentive, money, give people money to live a healthy life? Well, think about the return on investment on that. It's big. And if we're going to have tax dollars, 3.5 trillion per year, half of which is public dollars, wouldn't it make sense to have and help and incentivize people to live a healthy life? Absolutely. Now you're saying, where does that money come from? Where do we get funds? And don't look any further than what we've already talked about with respect to the commercial determinants of health. Think about those billions of dollars that we just reviewed. Open access to the market of America, creating chronic disease. Yes, we're going to ask, responsibility of society, where does money come to fund that? Sin taxes, alcohol, tobacco, unhealthy foods, opioid medications. We need to be able to fund those incentives for the Medicaid population. We need to be able to fund some of the insurance pool issues that you deal with when you push healthy people into a certain segment of the insurance population. The other half of the insurance world, you have to prop those insurance premiums up. This is doable. We can change. We have the ability to set a new path for our current and future generations with respect to healthcare and the sustainability of healthcare. As a nation, as a world community, we can choose to market facts. We can choose to market science, sound healthcare policy. We can market healthy behavior. Imagine a society, a country 50 years from now, 100 years from now, 2,500 years from now, that has a sustainable healthcare system. Will it really market unhealthy behaviors more than it markets healthy behaviors? No. We are creators. Let's be creative. Let's take the wisdom of the father of medicine and use it. Let's market healthy behavior. Let's market Hippocrates. Thank you.